Good evening, listeners. Welcome to Views on Health. A great pleasure to have with me on the program tonight Dr. Theekshana Pathirana, consultant oncological surgeon, Apeksha Hospital, Maharagama. Welcome back to SLBC and the studio, Doctor.
Thank you for inviting me, Fatima.
Pleasure to have you with us once again. And the focus tonight on the program is oral cancer. As an oncological surgeon, I hand the microphone over to you to tell us why you think oral cancer is a cause for concern.
Well, Fatima, last time we discussed about breast cancer, which is the commonest cancer for women. I thought it's fitting to look at oral cancer, which is the commonest cancer amongst men in Sri Lanka. And the other important thing is that this has been there for a while, taking that top spot, and it hasn't gone down for all these past many years. So the awareness of certain risk factors and things that we can change could make a massive difference.
So what are the causes that lead to oral cancer? What habits that men indulge in that brings about oral
Just
cancer?
a bit of correction now. I think the female oral cancer trend is also going up slightly.
Is that so?
Yes, but not massively, but slightly going up. The risk factors wise, the one of those risk factors in Sri Lanka and unique to us and this part of the world is beetle chewing. People do it as a hobby because their father did it, or because they do a particular job. They are in that kind of environment. Beetle quid has lots of carcinogens. You put erica nut in it, some calcium lime in it. All these have carcinogens which could give rise to oral cavity cancers. Apart from that, another important risk factor, which is probably the commonest risk factor for all cancers in the body, smoking, is a massive impact on patients and their health, especially with regards to oral cancer. So these are the two main risk factors in our setup, and there is also these human papilloma virus, which is also the virus that causes warts. A variety of it can cause oral cavity lesions, and we see people presenting quite late. It starts with a small ulcer in the oral cavity, but when they present, they come the lesion basically jutting out of the skin, eating the part of the skin, eating the bone, which is the jawbone. So we end up doing operations that are really horrendous and difficult to live with after the operation. So I think if you have an ulcer or some change in your oral cavity lasting more than 2 weeks, get it checked. Get a small biopsy, get a small piece out of it and see whether this is cancer. Nip it in the bud, and then that's going to save your life.
Thank you for drawing attention to the fact that women are also today prone to oral cancer because of beetle chewing. But this is something that we've seen in the recent past, and it's, when I say recent past, maybe the last couple of maybe a decade or 2 decades, and it's increasing.
It is.
So, doctor, just to clarify, just say a person just likes to eat the plain beetle leaf for whatever reason, would that be all right? Or would that not also be okay? Because accompanied with erica nut and the lime that comes in the chunam part of it is definitely detrimental.
Yes.
But the beetle leaf per se, would you be able to comment on that?
So there isn't, to my knowledge, there's not a lot of research on it, but the findings are more towards erica nut and the lime. But beetle also comes in most of the literature saying one of the risk factors, even without those substances. So I would say if somebody, it's a habit that you can't get rid of, I would say it's not a good idea to do it every single day or every single week as a continuous practice for many years. And the fact is that these effects do not come overnight. It comes after many years of usage. So about 10, 15 years down the line, you get these effects and you can't reverse it by suddenly stopping it because it has already caused a lot of damage. And it's not just in the oral cavity. The the part which the oral cavity opens into after the pharynx or the throat is the esophagus. So you can have cancers in the esophagus, and the risk factors are the same. Smoking and betel chewing are still risk factors. So that's what it is. And the other factor is that it's more prevalent among people of the low socioeconomic strata in those groups. So their education or knowledge about this is quite low. And I used to work at Anuradhapura Teaching Hospital for a short while before I left Sri Lanka for a few years ago. I've seen that's one of the commonest cancers presenting in that part of the country. And when I was in the UK, I have not seen cancers presenting in that extent. There is cancer because of smoking, but they present quite early, and the surgery is minor comparatively. But here we end up with doing quite debilitating operations because the cancer is that much big, and we have to basically take most of the important tissue for your mastication, that is eating, and also for speech.
Yeah, this is quite alarming.
Yes.
And we see even younger people today chewing betel, not just betel, but with the areca nut and the lime. And some of them even had pieces of tobacco. It all comes in this wrap.
Yes.
That is sold.
So tobacco is notorious. I didn't mention tobacco, but if there's tobacco, it's worse. So tobacco has compounds called benzopyrene. These are well-known grade 1 carcinogens. You can get cancers. Smoking also has tobacco in its nicotine as well. You can get cancers anywhere in the body with these kind of substances. So I think it's something to make the public, especially those people who the low socioeconomic group, they don't get this information, and it becomes a habit when they're quite young, and then they've done about 20 years when they hear about it, basically.
It'll be wonderful if our listeners can pass this message on to the people that they come across.
Yes.
Maybe their staff, maybe people in their office, wherever, who are indulging in this habit of chewing betel.
I make it a point whenever it could be in the shed, somebody who's pumping gas, I have told them this is bad, because telling them per se, that is the first step of inculcating a change in these people. Sometimes they have never heard that this is a risky practice. So I think spread the message whenever you see somebody chewing betel.
So chewing betel, smoking. Anything else? Any other habit that can bring on oral cancers?
A poor dental hygiene is also associated. If you get a lot of inflammation or infections in your oral cavity all the time, your gum is, or basically the lining around the teeth is not healthy, there is a chance. So those are the main risk factors. And apart from that, the virus that I mentioned, human papilloma virus, the wart-related virus, that's also associated with these cancers. And so something Fatima I didn't dive into is that oral cancer is just an umbrella term. So you can have cancers on the tongue, on the inner lining of the cheek, that is called the buccal mucosa, the gum, the lips, the floor of the mouth, or a soft palate, hard palate. All of that fall into the category of oral cancer. So it's the commonest sites are the tongue and the floor of the mouth. That's where the betel rests when somebody is chewing betel. That's the commonest sites, because betel is always on the side of the tongue or on top of the tongue. Those are very common places for cancer.
Have you come across any cases of patients who have not smoked, who have not chewed betel, but they still have an oral cancer?
The type of oral cancer that we are discussing is something called squamous cell carcinoma. Very rare. I can't recall that type of cancer in a person who had not smoked or had done betel chewing. But there are very rare other types of cancer that can come in the oral cavity, that those people could not have any of those risk factors. But that is very, very rare.
So you obviously will have to perform surgery. What are the chances, doctor, in this situation? I mean, when we discussed breast cancer the last time around, the chances of survival are great.
Yeah.
Early detection, certainly. Even if at a later stage, you can still remove the maximum that you have to remove to help a patient recover and live.
Yes.
But if you take oral cancer, in comparison, how does that fare?
Well, oral cancer is slightly different. It doesn't spread to other organs. Like, for example, breast cancer, if you come later, your cancer could go from the breast to the lung, to the liver, the spine. But oral cancers, it would the furthest it go would be the lymph nodes commonly. It usually doesn't spread elsewhere. So these people live, but the problem is when they come late, we have to control the cancer by doing operations. We can control that, but they end up with a poor quality of life. Their speaking is retarded, their eating is affected. So the early detection helps you to have a better quality of life. And speaking about early detection, I should mention about lesions in the oral cavity that could be cancer. So if you have a whitish patch, which we call it leukoplakia, that could be a cancer. There's even a higher risk if you have a reddish whitish kind of a mixture of appearance in the oral cavity. That's called erythroleukoplakia or erythroplakia. They are higher risk. And people who chew betel have whitish patches on the side of their lips. This is called submucosal fibrosis. This is also potentially cancerous. So these are possibly the early stages that people can come, or they have a small wound in their mouth that is not healing. This is when you should reach out and get it checked.
You spoke of difficulty in speech, understandable. What about eating, drinking?
So again, depends on what stage you present.
That's right.
So
But post-surgery, how does it fare?
Again, so our surgeries could be very minor, to just taking the lesion out, to taking half of the tongue out, taking the part of your jawbone or your cheek. So these defects that we create after surgery will have to be filled with tissue from somewhere else from his body or her body. So when that happens and they get a bit of radiotherapy to additional treatment, they have difficulties in opening the mouth. They can eat, but some people might end up unable to eat. It actually depends on when they present and how they present. So early presentation is going to get you the smallest operation and a better quality of life.
What is the age that you generally see people coming with this condition?
Generally, they present after 50 to beyond 50 years of age, generally 60s or 70s. But there are very rare patients who are young 30s and they are really aggressive, and our operations sometimes fail. They recover within, just as they recover from the operation, you find a lymph node or something coming up. So it could be an age like breast cancer, generally after 50, 60 years of age.
And again, post-surgery, the difficulties we know are, as you explained, speech, sometimes intake of food, drinks. What sort of recovery period is there as compared to other cancers? So
generally, if they come a bit of late stage, it's a major operation in the oral cavity. So during operation, anesthesia is very risky as well. So some of them require longer intubation period even after operation. So they should be in ICUs. So if they get a real major operation, taking part of the jawbone, putting a flap or some tissue from their body, they would save a variable time from 7 to 10 days, sometime a longer period in the ICU. So it's not a straightforward operation or an easy operation like breast, like we discussed last time. This is somewhat risky and takes a longer recovery period.
And you did say that unlike breast cancer, which can spread, if it's not detected, of course.
Yeah.
In oral cancer, it won't spread in that sense to any other part of the body.
It can if you leave it for a long, long time, but generally they spread to the lymph nodes and don't spread through the bloodstream to other organs like the lung, the liver. If at all, it can go to the lung, but that is very late. So what we see is patients having operations and having a bad quality of life rather than dying of distant of further spread. So so sometimes these are people who can do a productive life. So that is what's affected. Their quality of life is what's affected mainly.
So that is sad.
That is very sad. So, and these are sometimes the breadwinners of the family. They do very difficult jobs as farmers or daily paid workers. So when somebody gets an illness like this, the entire family cripples and their support structure falls off. So I think it's a simple matter of changing your habits could actually save a life and a family.
How does one create the necessary awareness in this risk category, risk group? As we know, it's mostly the low strata of the income earners who are indulging in this habit of chewing betel. Not so much the more well-to-do people.
Yeah.
They may do so, but they are few in number as compared to the others. So awareness is important.
Awareness is very important. And again, to add to that is the better sort of higher socioeconomic group who smoke a lot could be there. But they would present early because they are more self-aware and the healthcare reaching that tendency is higher. How do we improve that knowledge amongst people? I think there's a lot of work that can be done in the provincial and general hospitals, the MOHs, to educate these people. And apart from that, whoever knows about it, whoever listening, whenever you see somebody, just spread the word. Sometimes a single action, a single step could change their habits. Sometimes they just need an indication that this is wrong to change their habits. It's with smoking as well. It says that if a doctor says you need to stop this to a patient who's not known to them personally, that kind of inculcates a change. So I think that's, as a society, we have that responsibility of educating people.
Doctor, I've heard of people complaining, the sense they're lamenting, actually, not complaining, about their staff who indulge in betel chewing, that they find them not even washing their mouth before they go to sleep. They have this, bit of the betel.
Yes.
With the coconut and all of that goes with it in their mouths, and they go to sleep like that. That is certainly a dangerous situation.
It is. As I said, the cancers are commonest when there is stasis. Stasis is where it's stagnant. The cancer is commonest where the betel and the arecanut sets on the side of the tongue and on the floor of the mouth. That's where we see most of the cancers coming up. So, so it's very important for at least minimum they can do. If they can't get rid of the habit, at least make sure that doesn't stay longer in their mouth for that long for the cancerous particles to set its effect. But I think the best option is to get rid of the habit. Sometimes they need additional help, like somebody who uses drugs, who needs a bit of help to rehabilitate. Sometimes they need a bit more support and sort of longer motivation to come from just a contemplatory stage to take an action and stop their habit. Same with smoking. So,
supposing somebody was to take a decision, I'm not going to chew betel anymore because it's harmful to me. I can get a cancer, and then goes on to say perhaps chewing gum. Could you comment on that?
Well,
alternate option.
Yeah, so
something, whatever it is.
Yeah. So the thing is, Fatima, some of these we can't say this is better than the other one because some of them were not studied in that sense for that long duration. For example, vaping in the West, they're coming out of smoking to going into vaping. But nobody has done any research whether vaping has the same kind of effect. So I wouldn't go and recommend a particular chewing gum or anything, any alternative, because there's no research. But for a short term, to come out of a habit, it could work. Not forever. I think anything excessive is not a good idea. So, but to come out of that habit, using alternative options is recommended, and getting professional help, maybe a psychologist or even a counselor, just somebody who talks to you about this habit, because whoever that's trying to change a habit, they will fail at some point. And if they give up, then that's it. But if they keep on trying, there is a good chance that they will maintain it. People go through different stages of behavioral change. That starts from pre-contemplation. They haven't thought about it. Then they go into thinking about it. That is called contemplation. And then gradually they go into action. But action is going to fail sort of at some point. So they need that support structure. If there are triggers for some people. If it could be work, their working colleagues, their conversations might be associated with betel chewing or smoking. So these are things that they need to alter in their lives, find other alternative methods to get rid of the habit. It's not easy, but it's a progressive thing, ongoing thing.
So having performed surgery on a patient, can some sort of cancer recur?
Yes. So when we do operations for cancer, we know that there is a cancer in front of us, but we operate beyond that margin. So we go and try to take the cancer with normal tissue around it so that there is a negative margin or no cancer at the side of our cut. But we do this by just looking at it. But when the report, the sample goes to the lab, and the pathologist who slices this off and then have a closer look under the microscope might tell us, oh, there was some cellular level at the margin of the operation. So those patients who are unfortunate might get a recurrence if we leave it. So, and in that kind of situation, we have other options like redoing the operation, or redoing another margin rather, or giving something like radiotherapy, which is very effective for this kind of cancer. So that those are our options. But yes, they can recur.
Thank you, Doctor. So time has caught up with us. What is your message to our listeners?
So my message would be, if you have any new oral symptom lasting for more than 2 weeks, it's high time you reach a medical professional, get it checked, get a sample. And if you have habits like betel chewing, smoking, try your level best to get rid of it. And you could be affecting other people by passive smoking as well. So think about that.
Thank you, Doctor. And there we end this interesting discussion on oral cancers. To you, Dr. Theekshana Pathirana, Consultant Oncological Surgeon, Apeksha Hospital, Maharagama. We say thank you very sincerely for being with us on the program and sharing your expert knowledge with our listeners on this topic. Thank you, Doctor.
Thank you, Fatima. Thank you, SLBC, for the opportunity. Thank
you too to Prabha Veerasurya for technical assistance. I'm Fatima Razi Kader saying good night and hoping to catch you next Monday, same time on Views on Health.